5 things that you're doing in your 30s that are secretly making you look older and how to fix them. Hi, my name is Brooke Carrero. I'm an aesthetic nurse injector in the Philadelphia area, and I hate talking about myself. So let's talk about the aging face before we get into the 5 things that are actually aging you. A lot of people think that aging is just a physical thing, right? They come in, they're losing volume, they want the volume replaced, and that's done. But they don't realize that it actually goes deeper. It all starts from within. We actually have to turn inwards and look at our internal health too, because our internal health is what reflects the outside. Number 1 thing that is aging you in your 30s is not doing skincare. Yes, the skin is the biggest living organism. You have to take care of it. People come in all the time and they're like, oh, I want Botox and filler. But let me tell you, if you are not taking care of your skin, it doesn't matter what I do. You want to do facelift, other treatments. If the skin quality is not where it needs to be, you are not going to look optimized. So big thing that you can do if you're in your 30s and you're telling me that you use Dove soap, we got to talk, hon. Like, you need to be doing better skincare. And let me tell you, that doesn't just mean medical grade products. That means washing off your makeup at the end of the night. That means regular facials. People are like, oh, they're bougie, they're too expensive. No, let me tell you, even if you can do them seasonally, think about when you're walking down the street. I mean, I know me in the city, everything that's grabbing onto your face. You can only do so much at home to exfoliate and to clean. You have to go get a facial, so they're extracting, they're cleaning your pores out, your products are allowed to penetrate deeper. Facials are a must. And under that category of skincare falls things like microneedling, things and procedures to stimulate collagen production. Again, collagen is something that we lose in our 20s. We want to have procedures done that kind of create injury. From creating injury, a response is stimulated. That response is collagen production. Think lasers. It's not just skincare. Skincare is not just products. Skincare follows into the umbrella of everything that you can do to help the overall quality of the skin. So honestly, that moves into our second point. And let me tell you, that's not getting blood work done and figuring out what you're deficient in. Your skin tells the story of what's going on inside your body. So as we age, especially as females getting into our 30s, you don't realize that you're already starting premenopause. Our hormones start to shift, they change, our hormones change. It affects the skin. People come in all the time with hormonal acne all down here, and they're breaking out in their 30s and 40s and they don't know why. It can be a deficiency. It can be something that's going on within our gut. You go to the regular primary care doctor, they're only drawing CBC. Regular old labs, that is not telling the story of anything. You have to be your own healthcare advocate. I have gone as far as getting hormonal panels done. I'm actually going Monday and doing this full extensive panel talking about testosterone and everything else. Your skin is only as healthy as how you are internally. So big thing that you're not doing in your 30s is being your own provider and getting blood work done. You have to get blood work. You have to figure out what you're deficient in order to overall really care about the quality of your skin. Number 3 is overdoing it or not doing it at all. Neurotoxin. So neurotoxin is not just Botox. Botox is just a brand. We have other ones out there on the market like Jeuveau, Dysport. But when I say Botox, I mean neurotoxin. You either one, do too much, right? And your face is frozen and we're looking like a housewife. Not cute, that can age you. And the second thing is ignoring it, not doing it all because, oh, I don't want to get tox done because I want to be natural and I want to be who I am. But then you want to come in your 40s and you have all these resting lines, and let me tell you, I can't reverse that. So how do we fix this? We do minimal doses and adjustments that fit our natural appearance instead of trying to overall freeze. We have to have some expression because we are humans. And then underdoing it or not doing it at all, we can't ignore these things, right? Just like going to the gym, our muscles get stronger because we are going multiple times. It's the same thing with the muscles in our face. As we age, they get stronger and they create these wrinkles in our forehead. You can't wait until all those wrinkles are there. You can't go backwards. Once you start seeing those resting lines, this doesn't mean start in your 30s. This means start when you see resting lines, which could be as young as in your 20s. Number 4, ignoring that you're aging or ignoring the volume loss. Listen, we are all aging. Our skin continues to grow. We have volume loss that happens to our face, especially if we're losing weight. Ignoring that is going to make you look older. Listen, there's a thing as Ozempic face. You saw it. People went fully the other way and they looked older, right? Because they were all sunken in. They had no volume. Think about what makes you look youthful. Like someone in their teenager, they had these like nice chubby cheeks. And of course, when you're a teenager, you're like, I don't want this. But now looking in reverse, that's what makes you youthful. So ignoring the volume loss honestly is going to age you because you're going to need more the longer that you wait, which leads to unnatural results. Volume loss when you're at like a mild or moderate is the best time to start adding volume to the face because it gives a more natural appearance and approach. And number 5, chasing trends instead of balance. Now we can go the other way. We can have too much filler because we're chasing trends of the big overfilled lips or the nice high cheekbones. When we are chasing trends and we are not trying to balance the face, it ages you. I mean, let's look at some of these girls on Love Island or these reality shows. They look like they're in their late 30s, almost like closer to 40 when they're only 20 years old. Like, that blows my mind. I love these shows and all these girls are so beautiful on there, but I'm always trying to guess their age, and no joke, I'm always off by like 8 years thinking they're way older than they are. And that is because it's too much filler. These girls don't need this filler because they don't have volume loss. So chasing these trends of just trying to look a certain type of way is when you're going to age yourself. So think volume loss restoring rather than augmenting. So wrapping all of that up, really the things that age us are when we're kind of getting into augmenting instead of balancing the face. It's all about restoring. Listen, if you're 30, 40 years old, you're not going to look like what you looked like when you're a teenager in your 20s. It's not going to happen. So we have to understand that we are aging, but we can do it in a graceful way. And we do that in a graceful way by helping the outside appearance, restoring volume loss, but also internal health. Again, just because we're getting older doesn't mean we need to feel old. That's where the biohacking comes into play. So if we want to not look older than we actually are and we look a good version of our age, it starts from within, and that internal health reflects outside.